Okay, hi. This is part two of our lecture on chapter three, starting with the basic pathophysiological mechanisms that underlie alterations caused by environmental hazards. Okay, so if we look at some potential consequences of environmental agent exposure, okay? They can interfere with normal cell growth and function, right? Leading to things like cancer. Some examples of some of these mechanisms that can also occur, right? So genetic mutations, right? Remember, we already mentioned this, or I already mentioned this in terms of, there are chemical agents that are around in the environment that can lead to epigenetic changes, right? A term called oxidative stress, and we talk about this further or at another point in the semester as well. Things like ionizing radiation or other chemical agents like xenobiotics can actually cause cells to produce free radicals. Those free radicals, they're these reactive oxygen species, right? These free radicals can then interfere with cellular processes, and can also, I just lost my train of thought in terms of those free radicals. Oh, they can actually even lead to DNA damage inside the cell as well, okay? So they can impact other cellular mechanisms, but can also lead to damage of the DNA. Also, if we look at inflammation and tissue repair, I gave the example of asthma before, right? But there are many environmental agents that can induce inflammatory processes. If you think about inflammation in the airways, can lead to asthma. Also, we mentioned this too, I think, or I mentioned this when I showed you that diagram on the different concepts that are related to it. They can alter tissue repair mechanisms. And so this could be through like plant toxins that on the skin can actually induce issues with the tissues and interfere with tissue repair processes. Also, they can disrupt endocrine or hormonal function. And so in I guess some examples of this is that there are agents, environmental agents, that can mimic or block endogenous cell signals, meaning like maybe blocking a receptor that a hormone would normally bind to, okay? Also, oxygen deprivation is listed here. If you think about carbon monoxide, it basically leads to oxygen deprivation. This is also something that we'll talk about more specifically as we move on through the semester, okay? If you think about these pathophysiological mechanisms, sure, they may operate alone, but there may be a lot of those mechanisms that I mentioned here that could be happening at once. They also can sort of be happening sequentially, meaning you have some epigenetic change that occurs as a result of exposure that then leads to alterations in cellular function, and that could mean production of free radicals, right? Or what have you. And so you can sort of have this sort of sequential, you can have just one of those things happening, or you can have them sort of all happening simultaneously. Okay? Sorry, I'm just stepping away for 1 second. If you talk about here, if it talks about now development of a disease from some of these disruptions in physiology, right, or these pathophysiological mechanisms that we mentioned here, it may lead to disease, but it may not, right? I mean, this is just like what we talked about before. There are other factors, host factors, just basic function that can then come into play as well. So it says here, disease development involves mechanisms in various cells and tissues, right? So if you're particularly talking about these mechanisms that are happening inside a cell, you would have to have, one or more of these happening to multiple cells and then affecting things on a larger scale in order to cause disease, right? And so that's what this is referring to here. Also then, like I said, there's other factors that are going to come into play that could then cause that patient to then go into a disease state, okay? So social and psychosocial stressors, right, are linked to many disease states, okay? So again, if we go back to our asthma example, sure, there might be some environmental allergen that's increasing inflammation in the airways leading to asthma, But there are other factors that have been linked to asthma as well. So things like stress and other psychosocial, I guess we could just say stress in general, right? So psychosocial stressors can basically make that patient more susceptible to developing asthma as a result of exposure to some environmental allergen, okay? And again, there are many others as well. So just because maybe some of these pathophysiological mechanisms might be initiated by an environmental exposure, it doesn't necessarily always mean that it would then cause disease. So like I said, you would have to have, these happening on, in many cells, right? And then in specific tissues, and then ultimately affecting tissue function and organ function in order for it to lead to disease. So like if one or two cells were affected, it's probably not going to lead to disease. Okay. All right. So again, this was just a basic sort of outline of some pathophysiological mechanisms that can be induced by environmental exposure. And I sort of alluded to a lot of these that we're going to talk about these later on. Okay. So within this chapter, we're really talking about introducing the different types of exposures that are possible and then what they're linked to. We aren't really getting into any nitty-gritty detail in terms of, the pathophysiological mechanisms, right, that are listed here. So we will do that when we talk about the different systems, right? Then we'll kind of bring back some of these things. Okay, so I just wanted to kind of put that out there. That's why this is so short, right? Because we're going to be doing this all semester. Analyze the relationship between various hazardous agents and the health effects they produce. I think we've kind of been doing this all along. Some of this may seem a little redundant, but some of it's not. And so, again, referring you to a table in the book, table 3.4. And basically, this is primary health effects of environmental agents. So it's, again, going to break down these agents by these different classifications by nature, right? Biological agents, chemical, physical, and psychosocial. Talk about sources of exposure, routes of entry, the primary systems that are affected, and the primary health effects. So I guess this is kind of more of taking the sort of pathophysiology type of approach here in terms of here's an agent, how can you be exposed to it, or what are the sources of exposure, how can it enter your body, and then what systems would primarily be affected. So let me just quickly pull that up. I'm not going to go through the whole thing right now. You guys can take a look at that yourself. So this is table 3.4. Let me make this bigger. And again, I apologize if some of it ends up not being in your screen, but again, take a look at this yourself. So again, here's showing you some biological agents, specifically microbiological agents, right? Explaining where you might be exposed to these, right? How do they then get into your body? What are the primary systems affected? Okay. And then what potentially could be the health effects from it? Okay. So I think this is actually a really informative table here. Again, we're continuing with biological agents here, right? Bacteria, showing you viruses, also fungi, and then moves on to chemical agents, and then also physical agents and psychosocial agents. Okay, so important really to take a look at this and read through this. Again, not about memorizing, but although we should know probably that psychosocial agents are going to lead to mental health issues, right? If we're talking about, inhaled types of agents, it's going to primarily affect pulmonary systems. For instance, influenza, we probably already know this. If we added COVID-19 to this, we would have our primary systems being affected as pulmonary, but we know that there are other systems that could be affected as well. Okay, so again, taking a look at this is important, okay? Don't memorize, but definitely be aware of these different chemical agents and how they can affect your body and ultimately lead to disease. Okay, so again, we already talked about this, right? This classification by nature. So biological, chemical, physical, and psychosocial. So let's talk a little bit more about these, okay? So one thing I just want to mention before we talk about those different agents is the sort of, as a clinician, right? Kind of where do you fit into all this, right? It's super important to take a really good health history, right? So that you are aware of what exposures your patient or what agents your patient might be exposed to, okay? If that health history is not taken well, you can likely miss these potential exposures, okay? So that's what this is saying here. Components of an effective health history, details about potential exposures, right? Either in the workplace, in the home, the community, right? Both presently and also past. So a past exposure, say to like asbestos, and then you're a smoker on top of it, definitely increases your chances of developing a respiratory disease a lot more. Okay, so these exposures can sort of be cumulative. They don't always have to happen at the same time. Just like we kind of mentioned, that sort of sequential idea of those different pathophysiological mechanisms. You can kind of think of it the same way with these exposures. Okay, one initial exposure, if it's long enough and at high enough concentration, might be enough to lead to disease. However, a lot of times it's prolonged exposure in small amounts that ends up leading to disease over time. Okay, so those are things to think about, and so you have to make sure you get that information from the patient, and then think about it, and then think about their symptoms and how maybe an exposure could be causing some of these symptoms. Okay. And then there needs to be efforts to control those hazards, right? In terms of, if you're talking about in the workplace, different, changing work practices to lessen the exposure, wearing PPE, right? Engineering, meaning changing the way some of the built environment is set up, right? Also, I mentioned here biomonitoring. So there are some types of work that it's necessary to monitor those workers. And what do we mean by biomonitoring, right? So if you worked, as like a nurse in the occupational setting, you may have patients come in that you're regularly monitoring for a certain exposure, right? By taking blood samples or urine samples or what have you. And so this is definitely something that occurs, again, depending on what type of work we're talking about. So we kind of mentioned, right, like the coal workers and certain occupations where you're going to be exposed to things that maybe a normal person or a person from the general population wouldn't, okay? And so again, biomonitoring may be necessary. And again, you could be working, as a nurse in a specific workplace that maybe is your responsibility, part of your responsibility. Okay, so just a little bit more about these biological hazards, right? All the different categories. So, and again, we kind of been talking about these all along, so forgive me if this is a little redundant, but it's just sort of kind of solidifying that information of these different categories, okay? So biological agents linked to numerous sentinel health events. Yes, again, we can consider this COVID-19 outbreak as a sentinel health event. Not limited to organisms that cause infectious disease. So this is the idea. It doesn't have to be the whole organism, right? And a virus isn't an organism, right? But if you think about bacteria, right, like E. coli or something like that, they can actually produce endotoxins. And so if you look up the definition of endotoxin, I just pulled this like from Google, right? This is a toxin that's present inside of a bacterial cell. And when that cell disintegrates, even like, I don't know, it's disintegrating because of treatment of an antibiotic, it could still release an endotoxin. Okay, and so sometimes it's the endotoxins or these toxins that these bacteria produce that are responsible for the disease, not the actual organism itself. And so there's an example here of botulism. Okay, also LPS, lipopolysaccharide from the outer membrane of gram-negative bacteria is another example. So even though that bacteria is disintegrating, that LPS that's present in the membrane can actually then cause inflammation, and has been linked to sort of triggering asthma, because again, it can lead to inflammatory or increased inflammatory processes. Okay. So, and it's just mentioning here that these can be present in the workplace as well. Okay. If you think about food and waterborne infections, okay, they are prevalent. Okay. Apparently there are more than 38 million cases annually. I did mention this, that like in in underdeveloped countries, you definitely see more of these waterborne infections. How much we sort of monitor and how much those are tracked, probably not as much as they are probably here in the US. Some of the causal agents, bacteria, parasites, right? Viral organisms. I mentioned like flatworms, right? There's different types of parasites. They can be protists, they can be worms. So not only bacteria you want to think about here, okay? Example here of noroviruses. Apparently those cause nearly 60% of food and waterborne infections in the US, okay? So some examples there. We talk about chemical hazards. Most of this data is based on studies of occupational groups, okay? Because they have a greater chemical exposure versus the general population, as I sort of mentioned. So there have been a lot of epidemiological studies that have sort of, linked things like exposure to asbestos with mesothelioma. Okay, so it's giving an example here. So risk for developing mesothelioma is significantly higher with direct asbestos exposure. Where were people exposed to asbestos? Mostly in the workplace. Okay. Also, there are secondary issues with this. So family members of the exposed worker could be at risk for secondary exposure, okay, because of transfer of asbestos from clothes and shoes to the actual, to the family members, okay? So important to kind of think about this. The other things, so I just wanted to give you some examples in terms of what types of work, right? Shipbuilders, insulation workers. So these are some examples of some workers that may have been exposed to asbestos. Also, if you're exposed to asbestos and then you're a smoker, that you're going to have these two together is going to definitely significantly increase your chances of developing a respiratory issue, okay? In terms of physical hazard, okay, these can be both natural and human-made, okay? So some examples, ionizing radiation, okay? Natural source of ionizing radiation is radon. Artificial X-ray devices. Ionizing radiation is radiation that can give off electrons. It is capable of altering or causing genetic changes, okay? So ionizing radiation is particularly dangerous, okay? Temperature extremes, just basic weather changes, okay? If you think about workplace manufacturing processes, heat production, say during steel fabrication or some other type of manufacturing. Cold exposure as part of food refrigeration. These are all examples. If you think about the built environment, specifically with physical hazards, this apparently is sort of an emerging issue. So if you think about like land use and transportation avenues, that may not support health, right? So examples here, problems with heating and cooling, increases in pollution, right? Or release of chemicals into the environment as a result of this built environment, okay? Particularly if we're thinking about transportation avenues and uses of land in other ways as well. If you think about some outcomes of these physical hazards, right? Immediate health effects, if we talk about, right, sunburn, heat stroke, frostbite, tinnitus or tinnitus, however you want to say it, which is ringing in the ears caused by exposure to sound, loud sounds. There are also delayed health effects, right? So they can emerge, I kind of mentioned this before too, after prolonged exposure. So maybe smaller levels of exposure, but repeatedly, okay? So things like cataracts can form after long-term exposure to UV light. Carpal tunnel, right? Long-term exposure of doing kind of this repeated sort of physical task over and over again, okay? Again, you can have hearing loss due to noise exposure, and radon can cause lung cancer. Those are some examples there, okay? Last two slides here, psychosocial hazards, okay? If we think about in the home setting, abuse, right? Again, stress, general term, probably not the best kind of thing. I mean, stress can be caused by any of the things that we're talking about here, essentially, okay? But if you think about, again, just not a good family atmosphere. It could be like food insecurity that then induces stress. Abuse can induce stress. There are many things that we can many other examples we can think of here. If we think about school setting, bullying, harassment, this also, right? Yeah. Harassment can also be in the work setting, right? says stress from shift rotation. If you're working the night shift versus the day shift, also just demands, right? Job demands can, again, induce a psychosocial type of stress or hazard. Community center setting, road rage, okay. Natural disasters, right? Terrorist events, war. These are all things that are psychosocial hazards on the community level, I guess. If you take a look here and you kind of break down these psychosocial hazards in psychologic versus physiologic, what can happen, right? Like outcomes, okay? So if we talk about psychologic, these psychosocial hazards can ultimately lead to depression or anxiety, right? Things like post-traumatic stress disorder. If you talk about physiological changes that happen as a result of stress, and again, this is a good lead into our next chapter, we're going to talk about this. There are physiological changes like increased heart rate, right? Whenever you have this increase in sympathetic activity, and we're going to talk about that, increased blood pressure, increased respiratory rate, increased production of stress hormones that can then have, health effects down the line, right? Decreased digestive motility, injuries related to violence because of sort of psychological factors that then induce physical injuries. Okay? So, last thing, stress, like I told you, that is our next chapter. We will focus on that. It is a super general term. Okay? So, right, you can have exposure that's acute or chronic. There are many, many health outcomes that are a result of stress, right? And if you could see me, I'm putting little quotes up. Stress is a super general term. Okay, and we'll talk about that. All right, guys, thanks. That ends our chapter 3 lecture.